The first step in placing a dental implant is preparing the bone. After administering local anesthesia to ensure patient comfort, a small incision is made in the gum to expose the underlying jawbone. Using precision-guided tools, the dentist drills a small hole into the bone at a carefully calculated angle and depth. This step is crucial for creating a stable foundation that will securely hold the implant post. Once the drilling is complete, the area is cleaned and the implant is ready for placement. With the bone prepared, the titanium implant post is gently inserted into the drilled site. Titanium is used because of its biocompatibility, allowing the bone to naturally fuse with the implant over time in a process called osseointegration. This healing process typically takes several months, allowing the implant to integrate fully before moving to the next stage. After successful osseointegration, the next step is to attach the abutment. A small incision is made to expose the implant, and the healing cap is removed. The abutment, a small connector piece, is then screwed onto the implant, protruding slightly above the gum line. This abutment serves as the base for the final crown. The final crown is then cemented onto the abutment, completing the restoration and restoring full function and aesthetics. While many crowns are cemented onto the abutment, an alternative option is a screw-retained abutment. In this approach, the crown is attached using a small screw instead of dental cement. Screw-retained abutments are often preferred in cases where long-term maintenance and accessibility are priorities, making them a reliable choice for implant-supported restorations.